Okay, so I have my PPE on. The scene is safe. The number of patients is 1. The chief complaint is that the patient is feeling disoriented, dizzy, fatigued. I am not going to consider stabilizing the C-spine at this moment, and I will call ALS. Hi, my name is Lydia. I'm your EMT. How are you feeling today?
Um, I don't know. I just don't feel right. Something's not right.
Okay, so the patient is responsive because she is talking to me. My general impression of the patient is poor, and I would say the mechanism of injury and the chief complaint is just that the patient doesn't feel well. She just feels a little bit off. So first, I'm going to assess the airway. So the patient did speak to me, so her airway is patent. It does look as if she has equal bilateral chest rise. Because she is just feeling a little bit off, disoriented, dizzy, I am going to give her 15 liters non-rebreather of oxygen. So now looking at the circulation, I'm going to take the pulse. Okay, so the pulse is 64, the respiration is 14. The skin is pink, warm, and dry, and there doesn't appear to be any major bleeding. I am going to consider this a priority patient, so I am going to transport lights and sirens. So next I'm going to move on to OPQRST. So when did this first start?
A little while ago, I went out for a jog, and I don't know. I just didn't feel right. Like, I started getting dizzy. My head was hurting.
Okay. Does anything make it better or worse?
Sitting down feels a little better, but yeah.
Okay. And how would you describe what you're feeling?
Ooh, excuse me. My head is hurting, and I don't know. I just feel. I don't know. I just don't feel right. Like, dizzy and yeah.
Okay. And is it radiating anywhere? Do you feel any pain or numbness in your limbs or your head or anything like that?
No.
Okay. And on a scale of 1 to 10, 1 being you feel completely normal, 10 being the worst pain you've ever felt, how would you rate this?
I guess like I don't know. I've never felt like this before. Maybe a 5.
Okay. So not really pain, you just feel off. Is that what
Yeah.
you're kind of saying? Okay. And so time-wise, has it gotten better or worse over time? Or are there periods where it's getting better and then it's kind of going away and then coming back?
It feels like it's getting a little worse.
Okay. Do you feel any nausea? Have you had any vomiting?
No.
Any issues going to the bathroom?
No.
Okay. And you said you did have a headache, correct? Okay. So do you have any allergies?
No.
Do you take any medication?
I have diabetes, so I take insulin.
Okay. Do you take that regularly?
Yeah, I take it every day.
You took it today?
Mm-hmm.
Okay. Have you ever been to the hospital? Any hospital visits?
I had to go one time before when something like when this happened before. Something like this happened before.
Okay. So this feels very similar to your last visit. Okay. And did they say that you had hypoglycemia? Do you remember?
I don't know. I don't remember.
Okay. When was the last time you ate?
I had breakfast. Actually, I don't think I ate after that. I meant to eat after that, but I don't know, I just got busy.
Okay. And then was there anything you were doing that kind of led up to this? Any events that occurred right before you started feeling just off?
I went out for a jog, and I don't know. I just went out for a jog, and I wasn't feeling very good.
Okay, so just to get this straight, you're saying you ate breakfast, you took your insulin, you did not eat lunch, you did not eat dinner, and then you went for a jog, and now you're feeling ill. Okay. So I did talk to some of the family members, and they did say that she was just not acting herself. She seemed a little bit disoriented. She even had trouble speaking a little bit. She's just clearly not acting as if she normally would. So I did already take blood pressure. I said that was 122/82. I said her respiration was 14, and her pulse was 64. I am going to listen to lung sounds. Can you take a deep breath for me? Okay, so the lung sounds sound clear. I'm just going to listen to the heart. Okay. So then I would take a blood glucose level, and it seems to be very low. I also would take an oxygen. I would take her O2, which that seems to be about 98. It's pretty normal. I would, just because she does seem to have a little bit of an altered mental status, I would take a GCS. Okay, so I'm going to put my hands out. Would you just put your hands on top of mine? Okay, and then close your eyes. And don't let your hands drop, okay? Good. So she's not letting her hands drop. You can put them down and open your eyes. She is making eye contact with me. Her pupils are pearl. She does not have any slurred speech that I have observed. So now that I've done my secondary assessment, I will do my field impression. So my field impression of the patient is that she has hypoglycemia. So I would like to call Med Control to see if I have permission to administer oral glucose. So I'm going to call Med Control now. Hi, my name is Lydia. I'm an EMT. I have a 51-year-old female who has a history of type 1 diabetes. She does take insulin. She took her insulin this morning when she ate breakfast, but she did not eat lunch or dinner, and she went on a jog, and after that she was feeling disoriented. She describes having a headache. She's never felt this way before, besides the last time that she went to the hospital, when I suspect she had hypoglycemia. So her respiratory rate is 14. Her blood pressure is 122/82. Her pulse ox was 98. Her blood glucose level was below what it should be, and her pulse was 64. I would like permission to administer oral glucose. I would do 1 tube buccally, and I would put it on a tongue depressor and put it into the cheeks until all of it absorbs buccally. Okay, so I do have permission to do that, so now I'm going to do my intervention. I will just grab my oral glucose. Okay, so like I said, I'm going to put this on the tongue depressor, and I'm just going to put it in the sides of her cheeks and let it absorb buccally. So after I do this, I am going to reassess her every 5 minutes. I'm going to take blood pressure, respiratory rate, and pulse, and I will transport her lights and sirens to the hospital in a position of comfort. The end.